This Camtasia, we talk about management and leadership, and we kind of do a compare and contrast. The material for this PowerPoint comes from chapter 17 in your book. You need to be familiar with the key terms that are identified on page 295 and be able to apply them. Now, I always like to start off this module by asking, what is leadership? I want you to think about the floors you've worked on or floors you've worked on in the past. And have there been leaders there that aren't necessarily managers or directors of the units, but it's somebody that you really respect and that is able to motivate people and lead? I hope that the answer to that question is yes, because as nurses, most of us are very effective leaders. So your definition for leadership, it is the ability to influence others to respond. Here's the key, not because they have to, but because they want to. Also remember that leaders help others to identify and focus on the achievement of personal goals or organizational goals, or even unit goals. It is an interaction between two people that focuses on personal development of all the members that are within that group. Now, to be an effective leader, you need to have a skill set, and this skill set needs to have technical skills, human skills, and conceptual skills. In your book that is presented on page 299, it is box 17-2. And so when you look under technical skills, essentially what we're saying is to be an effective leader, you have to keep your own clinical skills and knowledge up to date. It has to be current. In addition to that, you have to be a willing resource person, and you need to be able to teach and help your nurses, your techs, your PCAs make sound clinical judgment and to develop other people's critical thinking. Now, when we talk about human practices or human skills, that is the ability to judge and to work with and lead others in a compassionate and caring manner. So to do that, remember, you as a leader, you need to maintain an honest, an open, non-threatening environment. So therefore, the people in that environment are able to share knowledge, they're informed of what's going on in the unit, and also it just encourages other people to discuss issues. A leader becomes a proactive problem solver. Okay? And they also maintain a very confident and positive outlook. They identify areas where members of their team are weak, but in addition to that, they also assist those members in developing those areas. Now, when we talk about conceptual skills, essentially what that is, that's the ability to understand the complex organization within a healthcare setting. And also what they do is they determine how best they can work within that system to obtain what they need. So when you look at these essential components of leadership, I hope the people that you identified as leaders within your department, they're able to match some of these components. I hope they're a role model. They're someone that you want to be like. They need to be effective communicators. They need to be able to motivate their staff. They also need to be flexible and proactive. So these are all the essential components of leadership. Now, when I talk about leadership, there's two different types of leaders. Okay? And one's not necessarily better than the other, they're just different. In your book on page 298, there's a box. It's box 17-1, and it actually compares the two. But you have a transactional leader, and what a transactional leader does, they focus on the immediate problems or the issues. And what they do is they use more of a award system to motivate. So they're focused more on that day-to-day operations that occur within the unit or within the hospital. Okay? They also monitor work performance, and they correct as need be. And really, they wait till a problem occurs, and then they're going to try and rectify the situation. Now, to contrast that, you have your transformational leaders. And what these people do is they focus on empowering and motivating their workers toward a common goal, be it a goal of the unit or of the overall organization. And the way they do this is they have awesome communication skills, and they're able to clearly communicate the organization's vision, and they also have a game plan for how we're going to get there. So another thing that a transformational leader does, they provide mentoring, and it's on a as needed basis. So these are your two different types of leaders. So you need to be able to identify what type of leader is in your organization, and then I want you to determine what type of leader do you want to be. Which one do you think would be most effective? Now, I would love to say that all of your management are great leaders. However, that is not always going to be the case. Just realize that a manager and a leader, while you want them to go hand in hand, they don't always do. So when we talk about management, what you need to realize is that management is a problem-oriented process with a focus on activities needed to achieve a goal. And essentially, it's an organizational goal. So what management does, it supplies the structure, the resources, and the directions needed for that group of individuals to meet that organizational goal. So when we talk about management, realize it means personal interactions, but the focus is on the overall group's process. So that is the difference between your leaders and your managers. So when we talk about managers, they do hopefully possess clinical expertise. They actually hold the formal position. So these are like your unit directors or your clinical care managers. And what these people do is they make decisions about the organization. And what a manager does, a manager plans, they organize, they direct, they control, and they staff. Now this is talked about in your book from page 301 to page 308. And they also give you some samples in there, some case studies that are really good that talk about different managers and how they are effectively managing and leading their organizations. Now in management, there's 3 different types of management styles. This is presented in your box in 17-1, and just realize that these leadership styles, they're just different types of styles. So you use different types of styles with different levels of employees. The first type of style we use is your autocratic. And essentially what this is a manager that determines the policies and they make all the decisions. They ignore everybody else's suggestions or ideas within their team or on their floor if it's in the hospital organization. So they dictate that the work with a lot of control. They're one of those people that tell you what they want you to do and how they want you to do it. They make very fast decisions. So typically this type of style is more successful with employees that have limited training or education. Okay. The second type of style is democratic. Now when we talk about democratic, remember this type of manager is going to encourage staff participation in all the decision making that goes on within the unit. They also involve the staff in all the planning and development. They motivate the staff when they do meet achievements, and also your communication is going to occur up and down the chain of command. So there's an open communication there. Most people like democratic management style because it actually builds responsibilities in the person that is under the manager. Now, this type of management style, it works best with people that are highly competent and highly motivated. So that's the majority of your health care professionals. This is the type of management style that we like. The last type of management style I'm going to present to you is called laissez-faire. Now, laissez-faire, this type of manager makes very few decisions and they don't plan well at all. So they don't provide guidance. They don't, like I said, they don't make decisions. Typically, they do not provide much feedback. And so therefore, their work output is typically lower with this style versus any of the other types of styles that I've presented. Now, you will use this type of management style in professional people that are very highly motivated themselves. I always like to talk about communication, because what you need to remember about communication is that it involves sending, receiving, or interpreting information. Okay? We need to communicate. Nurses need to be effective communicators. When we effectively communicate, we improve the overall outcomes for the patients. It builds teamwork. It also reduces errors. However, I always like to put this in here because a lot of people don't know how to communicate professionally. Okay? A prime example is if you are emailing somebody and you email them in all caps, that is considered shouting at somebody. Another thing is making assumptions. Let's say you read an email or you heard something on the floor that somebody said about you, and you just automatically take that at face value. So what I will always say to you is, when in doubt, you need to make sure and talk to the person and do not assume that they are trying to offend you or that what they said was negative.